Guys, this is a tissue expander. I brought home a friend from work today so I could better illustrate what I'm talking about when I talk about a tissue expander. So as a reminder, a tissue expander is a temporary device that can be placed at the time of the mastectomy or after the mastectomy that allows us to expand the skin. And you can see it's a circular shape and they come in different widths and also potential fill volumes. There's a whole bunch of tabs around. There's a clear tab at the bottom so that I know that it's the bottom. And these are what are sutured into your muscle if you're having above the muscle reconstruction. That's where it can be a little painful. So if you have a tissue expander placed and you feel almost like muscle spasms, you might not be imagining it. It could actually be from the sutures that we place in the tabs. Now you can see that the bottom pole of the of the tissue expander, it's like a little bit extra expandable in this region. You can see that there's like a little bit of extra potential fill volume down here. So a tissue expander, when it's expanded, has almost like a teardrop shape to it, which is different than an implant, and we will discuss later. But a tissue expander allows us to find this little magnet with a port in clinic. We stick a wee little needle into it and we can expand the expander. Every surgeon's protocol is different about how often they expand. I typically expand patients every other week until they're happy with their breast size. And then I usually let them sit at that size for 2 to 3 months until I do the exchange surgery. But every surgeon has a very different protocol and timeline for that. But this is what a tissue expander looks like. You can see the tabs, the ports, the teardrop shaped. The other thing that I want to point out is you can see when they come out of the package, they have a little bit of air in it. So this does have a little bit of air in it, but you can see even with the air, if I fold it, like I'm going to put it into somebody's chest, you can see it develops these kind of like sharp edges and like little infolding areas. This can be kind of uncomfortable and very palpable through the skin. So if you have a tissue expander placed and you run your hand over your chest and you feel something that feels bumpy or sharp, you could just be feeling the edges of the tissue expander. You could also be feeling your drains. So it doesn't necessarily mean that there's anything that's going wrong. So have you seen a tissue expander before? If not, is this what you thought it would look like? Let me know below.